we're adapting the intervention and how we're talking about different terms, how we're talking about different concepts, but we're also adapting the way we're providing that intervention.
Welcome back to another episode of The Force for Good. I'm Rick Gertsema, and I am the Senior Mental Health Advisor for Miller-Dwan and for Archimind, the Global Institute for Mental Health Solutions. It's really fun for me to have invited our guest today. Alesha Vega is somebody that actually we were on the same panel when we presented on Problem Management Plus at a national convention for the American Public Health Association. And Alesha, welcome. It's wonderful to have you here, and just such a wealth of information. I'm just so excited that you're here. So, as in typical fashion, what I would really like is that you introduce yourself, tell us a little bit about yourself, where you're from, and some of the work that you're doing.
Yeah, absolutely. Thank you so much for having me, Rick. And it's great to chat with you again and reconnect. So I am originally from Spain. I came in as an international student, and I still am working toward my PhD in clinical health psychology at the University of Miami at the moment. And, originally my background was not in psychology, so I had a very non-linear path to what I do now. I started as a dancer, as a performer, and studying musical theater and performing arts in New York, and slowly found myself into the field of global health and mental health, ultimately leading me to pursuing this PhD in clinical psychology at the University of Miami. So that's just a little bit about me, but I don't know if you have any specific follow-up questions to that.
So you've also had, you were involved with Dr. Adam Brown, and of course, Adam is our senior, our global mental health advisor for Archimind. Can you talk a little bit about your experience at the New School for Social Research and with Adam?
Yeah, absolutely. So Adam was my mentor and it still is. And, I think mentorship is a lifelong relationship. And I'm so grateful to have him in my career and in my life. And so when I graduated undergrad, like I said, I was working toward a degree in performing arts and also taking classes in global health. And I ultimately found that I wanted to pursue a master's in psychology and wanted to focus in the global aspect of mental health, which is how I got into the new school and found Adam's lab. And to be completely honest with you, it wasn't my initial idea. I had one conversation with Adam.
Right.
I just reached out because we had a lot of people in common organizations we had worked with, and he had been a professor at the university where I got my undergrad degree, and we got connected. And in that phone conversation, um, Adam was talking about his work in global mental health, and I was like, okay, I guess I could do this. I can start with this. It wasn't really where my ultimate goal at that moment was. I was more interested in just basic research in trauma, and Adam said something that I always talk about, and it really struck me. Um, and from there, I think my perspective shifted a little bit around care and around mental health, and it's a little bit how I got into this field. He said to me, I do this work because care doesn't only happen in expensive offices in the Upper West Side. And when we think about therapy, when we think about psychological services, we often think about the traditional spaces, right, in which
Right.
psychology started and therapy started, and how a lot of people still get care. And there's nothing wrong with those spaces, and it's part of a system, right, and of how we can access and get care. But it also made me think about well, there are other ways, right, in which we can think more creatively and collectively, right, around how we can provide care. And mostly the communities and the populations that are most in need of care may not be able to access those traditional spaces. Um, so with that, I started working with Adam a lot in humanitarian settings, thinking about scalable mental health. And I know we'll talk a lot about that more concretely, but this
Right,
idea
right.
that we can provide care in different settings, right? And in ways that don't necessarily require specialist providers, and that we can empower communities to provide support for others within their communities. So my experience at the New School was a lot around that. Was working in different global and local contexts, adapting some of these interventions that had been in the global map for a few years at that point, and that we were starting to research and find ways in which we could adapt and implement in the most efficient and relevant way to our communities in New York City and in other spaces that maybe, traditional care wasn't the perfect fit, or where even the original ways in which we would provide some of those interventions as they were originally developed didn't really suit the context.
So,
So,
Alicia, were you involved with Recoup New
mhm,
York with Adam? I
yeah.
thought so, and that, well, Adam is incredibly persuasive, as we both know, um, and and so as he was doing that work, um, Recoup itself. Could you talk just a little bit about Recoup New York and how that whole initiative even started?
Yeah, so for Recoup New York, that was a larger randomized controlled trial that was conducted in partnership with George Washington University and the New School in the five boroughs in New York City. So we partnered with community based organizations around the city to be able to train staff mostly and volunteers at those. Community-based organizations, which I'll refer to as CBOs, in this intervention called Problem Management Plus, which we've talked about before, right? But it's
Right.
a shortened version of cognitive behavioral therapy adapted, developed by the World Health Organization to be provided by non-specialist providers or community providers, originally for humanitarian settings, but we're increasingly adapting it to different contexts in the United States as well. So, um, the aim of that project was to examine whether we were able to train people in those CBOs around New York City, and just look at different metrics, right, around impact, around feasibility, around implementation, and so forth. So the idea was, during the COVID pandemic, there were a lot of communities that were more heavily impacted than others, right? So looking at that, and being able to think about creative ways in which we could expand mental health support in a large city like New York City, right? Where we would think that there are a lot of resources available, but the disparities are also very significant. And we want to make sure that we are being innovative and equitable in how we're thinking about expanding care in different contexts.
Sure. And the work with Recoup
Mhm,
was how I, we were introduced to Adam. I was told by a professor in Amsterdam actually
mhm,
about Recoup, and that's how I was able to meet Adam. And then um, at that point was when we talked about what if we brought PM Plus, Problem Management Plus, a scalable mental health intervention to the Twin Ports of Duluth, Minnesota, Superior, Wisconsin. And so that really was the beginning of work with, and I've used the phrase scalable mental health many times. And, and you certainly have a ton of experience in that regard. So would you be willing to explain to the listeners what is this whole concept of scalable mental health intervention, non-specialists, the whole
mhm.
sort of the whole idea behind Problem Management Plus, ease, and some other programs?
Yeah, absolutely. And I'll preface this by saying, there are a lot of definitions and scholarly definitions that we can look out there, right? And we can reference. But I think ultimately the way I'll approach this question is really from my experience and from my perspective, and how that perspective has also evolved as I've been spending time in this space. So
Absolutely, absolutely.
I think for the scalable part, right? So I will kind of break down the term a little bit because I think sometimes it's helpful to think about it this way. So when we think about scalable, we think about reaching numbers, right? We think about reaching a lot of people at this like more macro level. But I also like to think about it as the individual level and and including the micro level and how we're thinking about this macro level definition, right? So it's not just how we reach the most amount of people, but how do we reach the most amount of people in the most effective, relevant way for each
Love it.
individual, right?
Yes, love
We
it.
want to make sure that we expand the way and we expand the numbers that we are reaching in terms of individuals and communities receiving care, because we know that there are contexts in which it's going to be very hard to reach a lot of people, right? And we want to make sure that that if we are providing care, the most people can get it, right? But at the same time, I really like to think about scalable not just as that macro sort of overarching umbrella approach, but how do we reach individuals while we're reaching masses, right, so to speak. So um,
Exactly.
I think within Scalable, there's it's kind of nested the concept of adaptation and the concept of really being able to tailor the care that we're providing to the communities and individuals that we are providing this care for. So we think about scalable mental health also in the context of how do we adapt some of these evidence-based practices that we know and that really amazing people are out there in the world testing and making sure that they work and that they provide the effect sizes in terms of intervention effectiveness that we want. But that concept of effectiveness, it also entails how does this work in the real world, right? And how can we think about very specific ways in which we can tailor the intervention and the implementation to fit the needs of the community that we're serving.
Yeah,
Um,
and that idea about adaptation.
right.
So, really understanding the community. So, my experience and the experience at Archimind has been more local, community based organizations. We've done some work with the International Rescue Committee, and they've worked with Venezuelan refugees and Afghan refugees. Uh, and, and so that adaptation piece really is about how do we really make it sort of their in their context and their words so that it really can become an effective intervention that they can use.
Absolutely. And there's a metaphor that as you were talking was just coming to mind. We often think about in romantic partnership, right? Like speaking the each other's love language and kind of understanding each other's language so we can have a conversation that aligns and it's tailored to how you are understanding love in that context, right? So if we adapt that metaphor to interventions, how can we speak the language of care that our communities are speaking, right? So we're not just adapting, and when we talk about language, we talk about a lot of different constructs that are embedded into how we think about language, right? So we're adapting the intervention and how we're talking about different terms, how we're talking about different concepts, but we're also adapting the way we're providing that intervention, right? And the sort of the avenues in which that information is being provided, right? Whether that's the setting, are we providing this in person or virtually on the phone via text, right? And being really creative about the format. Are we providing this intervention in a group setting or an individual or both, right? Is this being provided by community providers, or do we need specialists because that allows for a little bit more of um, the reliability, right, component, and the being able to say like, okay, experts are saying this, right? So just being really focus on speaking that language of care that the community we're providing the care for is speaking, is going to be really important in being able to be effective in how we're providing that care, which goes back to kind of that definition of scalable that I was getting at.
Right. And then you talk about adaptations and you think about different formats. You've
Mm-hmm.
done some really interesting, fun work with more digital delivery.
Mm-hmm.
Can you tell more about that?
Yeah, absolutely. And I'm smiling because yeah, that's really fun. And like we think about research and we think about clinical science and something really tedious to do, and or at least stereotypically, right? And it's been really such a fun ride to do this work, and I think that's also the unique aspect of scalable mental health. And I'll answer this question, and I'll also get a little bit more into the mental health part of the scalable mental health definition, right? So, for some of the digital adaptations that I've worked on with Adam Brown in his Center for Global Mental Health at the New School, or in partnership with them, is the latest one has been adapting PM Plus and Self Help Plus, which is another intervention developed by the World Health Organization, into a telenovela format. So for our viewers or listeners who don't know or don't have a specific sense of what a telenovela is basically a cultural format of a soap opera, very common in Spanish speaking countries, right? So we think about entertainment a lot as consumption, right? Or if we think about it on the other end of the spectrum as marketing, right? We've all seen those ads with like a story that tells us to not smoke or to decrease our drinking, right? So the aspect of media and entertainment and stories being embedded in public health campaigns is not new. But thinking about how can we not just adapt the intervention and the delivery of it at a superficial level with some of the aspects that I was talking about in terms of context, who's delivering it, which are all extremely important, but get going a step further and thinking about how can we do this in a way that's even more scalable, that it's even more relevant, and that actually meets people where they are. Um,
Exactly.
really the idea of creating a telenovela well came from a lot of places, but just to make a long story short, it was really about thinking, what are people watching, what are people consuming in this community that is being very hard to reach, right, and to engage in our interventions. um, and a very obvious thing that came to mind is telenovelas. And it's also very family friendly. A lot of people watch it in family settings. It's very scalable because you can just put it in a phone, in any device, and kind of carry it around with you. So also thinking about people in transit, and kind of being able to provide some basic support at that level. And with that, we also think about stepped care, right? So it's not that we're saying that any of these more innovative or lower intensity mental health solutions are replacing specialist care, but they are kind of stepping the way up to specialist care in a way that maybe not everyone can access specialist care right away or ever, or at different points in their journey and their life. There may be moments where specialist care is needed but it's not available, or moments where specialist care is not needed and you just need some basic information and support, right, to get you through a difficult transition or life moment. So it's really thinking about this staired approach, right, where there are different steps toward care, and that we are kind of filling in the gaps for those different steps to have something in them, right? So it's not just going from zero to psychiatrists and psychologists, but having steps in the middle that we can create further access for different people and different needs, right? So that's a little bit where this idea of digital innovation comes in, and thinking about ways that we can reach people at different stages in their journey and in their life.
And so from telenovela, you're now in Miami, and you certainly are aware of the work from Miller-Dwan Foundation to Archimind. And based on what you know about Archimind and your experience and your education, now working on your PhD. What would you say, how would you summarize what you find exciting about the work that's happening with Archimind?
Yeah, absolutely. So my work in Miami has, I wouldn't say shifted, but expanded slightly, right?
Right.
From the perspective of global mental health and integrating the behavioral medicine and health psychology perspective into my training has been really interesting, and also shifting that idea, or not, again, not shifting, but expanding that idea of mental health into a more holistic fitness perspective, where there are different aspects of both psychological, physical, and social health that we're going to integrate in how we're thinking about interventions, how we're thinking about prevention, and how we're thinking about supporting people. So with that idea, I think something. Well, there's a lot of very exciting things. I'll be very honest with you.
Nice.
um, Both Miller-Dwan Foundation and Archimind are doing. But I think one of them is really this idea of a very comprehensive way of thinking about how we support people, right? So thinking about the psychological aspect, but also thinking about the community aspect, and how we can empower communities and make the interventions that we're doing a little bit more sustainable, both in terms of benefit retention, but also in terms of implementation. So I'm an implementation freak. If you talk to any of my mentors, that's all I talk about. That's what I dream in, and that's the language my brain speaks, right? When we think about how do we reach people, and not just how we reach people, but how do we get people to do the thing that might be helpful for them and that we found in the science that it's most helpful. That gap is very big. And then the next step in that gap is sustainability. How do we maintain this new thing that people have learned into their daily lives and into the future, right? Um,
Exactly.
so that continuum, I think, is really exciting, and I in my experience working with all of you, that's really been the center of the questions that you're asking. And with that, I also think there's a lot right now in the world around digital interventions, digital mental health. How do we get more information to people? Psychoeducation, meditation, right? There's a lot out there. And what I find that a lot of those initiatives, which are wonderful, may be lacking is the aspect of academic partnerships, right? And really thinking about how we can not just think about this from the nonprofit sector or the commercial sector, but also the academic sector, right? And then on the other hand, there are a lot of research teams doing work, but not necessarily having those community and commercial partnerships that are going to help sustain the work in the longer term. So the holistic vision, right, of really partnering with different organizations, having the science, having the researchers, right, and
Right.
having the people doing sort of that very important evidence-based work to tell us what works, because we want to be grounded in science, right, while at the same time partnering with philanthropists, nonprofit sectors, foundations, organizations, whether it's at the community or the global level, to be able to provide that sustainability and implementation component to how we're reaching communities through some of these programs, and then also adding the commercial sector and thinking about how what's the role of the private sector here, and how we're integrating that, and then also adding the public sector to it, right? Thinking about policy, thinking about the larger perspective, and how do we sustain these initiatives in the longer term. So that partnership aspect, that sort of team science and team implementation approach that Archimind is taking, it's truly refreshing and exciting, right? And it offers a lot of opportunities to how we're thinking about this in the future, not just how we're developing new things, but how are we sustaining and making sure that these interventions and these programs that we're developing and researching are actually reaching the people that we're aiming to reach.
Right. And I, as I listen to you, really thinking about mental health and well-being, right? Really thinking about well-being and what is. I mean, we talk now a lot about what is mental health, and mental health is health, or health is mental health, and really making an intervention relatable, regardless of the environment. that the intervention is being delivered.
Yeah, exactly. Um, yeah, and I think really thinking about those partnerships is absolutely key. And the other thing that um, I'm so grateful for the support of Arkamine and Miller-Dwan in my own career, right? And both from the mentorship perspective and the providing fellowship support aspect as well, as I'm pursuing my doctoral degree, but also the opportunity to be part of leadership initiatives, right? So as co-chair of the strategy council, I feel like there's such a need in a lot of these new initiatives to involve young people and to involve perspectives from different backgrounds, right? That have that open-mindedness, right? And that
Exactly. Yeah.
innovation mindset, that and that vision of the future, right? That's so important. My current lab is more of a cognitive neuroscience lab, and we think a lot about future self. We think about memories, we think about attention, we think about mindfulness, and that aspect that I'm just starting to learn about in terms of how we think about the future is so important to how we're shaping our behavior, our initiatives, our both as individuals and as teams within our organizations, right? So that aspect of really involving people from a lot of different contexts, from a lot of different backgrounds into what you're building is so powerful, and I think it provides such a rich approach to how you're building something new, right?
Yes. And Alesha, you have such a promising future. We're so delighted. I'm so delighted personally and professionally to know you and the energy and the intellect that you bring to this work and your optimism. And I really appreciate that you took time today from sunny, warm Miami, where it is in Duluth is foggy, cloudy, and 58. So while you go outside and warm up, I'll be inside maybe thinking about starting a fire in the fireplace.
Maybe
so
next we
I,
do it in Miami, right?
I really appreciate your time. Thank you for joining us. And to our listeners, thank you so much for listening. And please join us on all social channels. We are excited about the work that we're doing. Where our goal for this year actually is to complete 10 trainings, and the work is happening. We are going to be Archimind will be launching its first national training by application. That'll be starting on World Mental Health Day. So please keep in touch and continue to join us in being a force for good.
Thank you so much, Rick, for having me, and it's such an honor to be part of this work.
Thank you, Alesha.